Hello and welcome. My name is Bethany Thrasher, and I am so excited to share with you a small talk about civility and professionalism in healthcare. So I'll begin by saying I have no conflicts. I have not been paid by Dr. Renee Thompson or Dr. Cynthia Clark, who I'll be referring to some of their work. I have no conflict of interest in any of that. I'm just going to be sharing from my heart as a registered nurse, some thoughts around what I found in the literature related to civility and professionalism in healthcare. So I'll be sharing some crucial details about the impact of incivility and bullying in the healthcare system, as well as in healthcare, meaning person to person with healthcare professionals. And I'll be making mention of Dr. Renee Thompson's 2019 article, What If You're the Bully?, which is published in the American Nurse Today. So every step of this talk is filled with kindness, openness, and I really want to warn you that there may be some triggers as you go through and listen, and that may remind you of situations that have happened in the past to you or around you, and that could evoke some emotions depending on what your response was at the time. So I just want you to think about that, and if you need to pause the video and take some additional time, please feel free to do that today. So how we treat one another is a choice. How we respond to our environment, it's a choice. So what do you choose, right? PM Forney co-founded the Hopkins Civility Institute, and he said, a crucial measure of our success in life is the way we treat one another every day of our lives. So not just today, not most of the time, but how we treat each other every day is a measure of success in our life. So I love that. I love that quote, and I thank him for it. Authentic respect for others requires time, presence. We need to engage with one another and have that mutual respect to trying to find the common ground, at least according to the work of Clark and Carnoso in 2008. I really think about, for myself, have you worked with others that you don't really care for? Have you ever had that individual that when you arrive at work that day, and I worked in the acute care setting quite a bit earlier in my career, and was there a person that was at work that you didn't really care for? You wouldn't hang out with them after work. How did you function within your role as a professional? Were you kind? Yes, kind. Did you function in a professional manner with communication with them? I think it's a good point to reflect on how we've behaved in the past and what are our contributions to the profession in terms of how we function in our everyday role. So where do we begin with all of this? Because we are caring and giving, and we're dedicated to the healing and health and wellness of others, right, as healthcare professionals. So where do we begin? We begin with, as many experts have said, and I'm sure you would agree, with self-awareness. So we need to identify behaviors within ourselves, and we need to ask for honest feedback from our peers and people that we respect and value. And that's the beginning point. So our talk today is going to be around incivility and professionalism. So we'll be looking at bullying and incivility, what's the differences there, the impact to the US healthcare system, as well as to nursing, because I'm a nurse. I'll be speaking briefly to the scope of the problem in nursing. And we'll look at self-awareness. We'll look at the survey, What If You Are the Bully, that was created by Dr. Renee Thompson. And we'll be addressing some of the professional practice interventions that we can initiate in our workplace to improve the the professional communication and hopefully create a culture of openness that would encourage very civil behavior with one another. So we'll talk about what now, what next, what are we going to do with this new awareness that we have. But let's begin with looking at the difference between bullying and incivility. So bullying is unwanted, aggressive behavior. And back, as far as I can recall, I only think about bullying in terms of children, right, in grade school, but we are seeing this type of behavior with adults in many workplace settings, not just in healthcare. And so that's why we're having, this discussion today. So the behavior with bullying is repeated over time, or it could have the potential of being repeated, or there may be that perception that there's a power imbalance. And that power shift or dynamic could change over time. Again, as I said, if there's a repetition around it, that it may have happened once, but have a potential of happening again, maybe if the situation is right. And again, we go to the perception of the individual. Do they perceive that they could be in that situation again, subject to the bullying? And bullying are things like, making threats, spreading rumors is an element of bullying, attacking someone both verbally or physically. And yes, I've seen these things take place in the workplace setting, or something as small as some may think as excluding an individual from a group, or maybe in a special activity. So bullying can be verbally delivered, socially with maybe cliques, maybe speaking ill towards an individual's ethnicity, race, their skill level, or there could be physical bullying that takes place. So we'll talk a bit more about some of that as we kind of move through. But incivility is really acts of aggression or inaction. So there's a spectrum there. It could be many different levels. It could be highly aggressive. It could be just those microaggressions that you stop and think, should I be concerned about that? Was that something that I need to be, that I need to address? Maybe so small that you may not think that it's something requiring being addressed. So there's a lack of respect. It could be even found in a leadership style, that authoritative behavior, not really getting the partnership in with the team on making decisions and that sort of thing. Looking at elements of gossip, cliques, facial expressions. This is a tough one for me in terms of I often wear my emotions on my face, so I don't know if that's something that you struggle with, but we really need to consider, how are we responding to one another? Are those small facial expressions, and we'll talk more about that as we go through this, are they an act of incivility on our part? So professional, ethical, respectful behavior as civil people, we really want to avoid being cruel or uncaring, uncivil, and really brutal to colleagues, right? Within each of us lie good, bad, and sometimes ugly behaviors, according to Clark and Carnoso in their 2008 article. Then they suggest that those elements can show up in the workplace, whether we like it or not. So we have to be intentional with how we address and think about our behaviors. So some behaviors, such as like eye rolling or not being friendly, can elicit less damaging effects, but all of those behaviors can be limiting to high level communication and teamwork in the healthcare setting. So really looking at ignoring requests for help, withholding information, that has definitely happened. Well, not giving the full report on the patient is you don't have time, or, we'll see how they can handle this because they should be able to manage it. Disrupt work environment and threaten the safety and quality of our patient care. So we have to be mindful of these things. If you see something, say something, address it. If you've been participating in some of these types of behaviors, I'm going to give you some ideas on how we can make change in ourselves to really rise to that higher level of professionalism. Again, when caring and compassionate nurses resort to silent treatment, making unfair assignments to others that they don't really care for, or openly criticize colleagues in front of others, patient care is compromised, and we need to make change. So let's talk about the impact to the US healthcare system and nursing. So, we know that bullying is widespread. The data just reveals it to us. And according to a recent report, 60 million Americans reported being affected by bullying in the workplace. This is across professions, so not specifically in healthcare, but 90% of new nurses report experiencing bullying from other nurses. So I imagine you may have heard the phrase nurses eat their young, and that could have an element of truth in accordance with what's being reported here. A 2019 integrative review really addresses the impacts of bullying and we can see here that it's both physical and somatic. There's an emotional distress component in the somatic. The Joint Commission revealed in 2016. So it's a little dated, but there hasn't been a lot going on with the pandemic in terms of reporting out on some of these elements that the healthcare setting and patients' lives can be affected with long-term impacts resulting in hypertension, heart disease, ineffective coping responses, stress responses, and we see that there's an additional component to the healthcare system in general. Financial and economic impacts are found in increased use of sick time, turnover. People just simply leave those negative cultures and in work environments. There's an increase in HR dollars that have to be spent in recruiting and preparing new staff for their role. And another element or statistics that I wanted to share with you is from the Journal of Organizational Culture, Communications, and Conflict. They revealed that workers reported that 25% reported being bullied directly, and 20% of those who witnessed bullying were affected and left the workplace. Those are significant numbers. So we know the cost of training new healthcare professionals in our institutions is significant, right? We know that there's a human cost, as was mentioned in the physical and somatic impacts. And finally, the International Labor Organization has estimated the cost of interpersonal violence, which includes bullying as an element in the United States. The impact is between 4.9 and $43 billion a year overall in the labor market. This is incredible, and this should get our attention and our leadership's attention, and some of the elements that we can implement to make change are critically valuable at this stage with this new awareness. So the scope of the problem within nursing, 30 to 50% of stress-induced illnesses are reported to be caused by bullying behavior. So we're in healthcare, we're taking care of individuals. We need to consider some of these bits of information. So research has connected many health impacts: fatigue, sleep disturbances, ulcers, migraine headaches, GI issues, poor concentration, and other mental health impacts like worrying, depression, anxiety, even post-traumatic stress disorder with some significant experiences with bullying have been reported. So research has found that there's been an increase in neck pain and diabetes. So we know that there's a tremendous amount of physical and psychological consequences. And additionally, we have good news, right? Our nurses in particular speaking out. So nurses are, and what has been reported most recently is, and this is in the work of Dr. Renee Thompson, is that when a survey was conducted, nurses reported that in the past 2 years, 62.8% did intervene when they witnessed a bullying situation in the workplace. 43.9% reported reprimanding the bully in public, which is takes a lot of courage. And I hope that they did that in a very civil and professional manner. And you can see the other statistics here. It's really important. We need to intervene when we witness these uncivil behaviors, these disruptive behaviors, bullying in the workplace. So I mentioned previously that there is a survey to conduct a self-assessment, so you can really look at your own behaviors, knowing who the bullies are. Really, healthcare professionals fall into one of 3 categories, according to Dr. Renee Thompson. And she said they're either the target, a witness to the bullying, or they are indeed the bully. Right? So what if you're the bully? The survey helps you to really look at some of the elements that would identify bullying or incivil behaviors, and those that can be contributing to an unprofessional work environment. So it's a really quick and easy survey, and you would be able to kind of go through the survey itself and really look at some self-reflection and maybe some change within your own behaviors. So, or looking at how you have really developed over time. So these are just a few of the items from You Are the Bully survey. So if you're answering sometimes or frequently to one or more of the questions, you may be displaying some of those elements of bullying yourself. But remember, again, the first step to success is self-awareness. And the second step is adapting your behavior. So I just wanted to share a few of the questions. So rolling eyes, making mean faces. We talked about facial expressions in terms of bullying and incivil behavior. Talking about people in a negative way when they're not around. Really, I know we often will say, to defend themselves or to speak up and really to, make a case for whatever it's being addressed. But if you find that that's taking place within yourself or others, again, intervene, please. Ridiculing a new or an inexperienced coworker. This strikes a chord with me as a nurse educator, because I feel that we have an obligation to work with and serve and really help to grow and strengthen our new healthcare workers as they come in. And this last item, I've been told that I intimidate other people. I know that there's a lot of thought around, if people are intimidated, that's on them. But really think about whether you're striking any of these other boxes or questions with sometimes or frequently. Maybe there's some merit to making change with your professional practice. And again, the Disruptive Behavior survey is another survey by Dr. Thompson, and it's from her latest work. And I'm not going to go through these questions, but I put a few of them on the slide here for you to be able to take pause and read through them yourself and consider some of those elements. I think that for me, looking at the bottom two, hearing nurses calling names or making ethnic slurs, jokes, or inappropriate sexual comments, those things need to be addressed immediately. It's just completely unacceptable in today's milieu. We have no defense to participating or allowing this type of behavior to take place around us. We have the knowledge, we have the awareness, and we have the ability to make change. And so I encourage you. The last item as well, being retaliated against for speaking up or not following the crowd. I actually think that individuals, and many people do, that if they speak out, they have great ideas, and this is where innovation is found. And when we have a culture in which individuals don't feel that they can share their ideas, that there may be retaliation, or if they speak out about flow or process that needs to be changed, we really are limiting the growth of our environment, and so many amazing opportunities may never be uncovered. Okay. So what are our next steps? So we look at professional interventions. We can see that, obviously safe patient care relies on three main things: efficient team performance. The team needs to be working in accordance with one another, having that respectful communication, effective communication. Are we being able to send messages quickly? Is there an easy flow of communication between our team members? And it's civil conversations, right? We're listening to each other, we're hearing each other out. And finally, the ability to constructively address and manage conflict within the healthcare setting, with whether it be patients' families, patients, other colleagues. Are we able to manage conflict in an effective way? Additionally, when we look at as healthcare leaders, and individuals that just really want that high-level working environment, we need to address it through professional development. We have opportunities to really look at ways to integrate problem solving, case studies, really giving ourselves the opportunity to think about situations that we may come across in the future and how we can respond to those situations. We're really acting them out. The role playing is really helpful for many in developing new skills in order to address bullying or incivil behaviors, those disruptive behaviors that may take place, and to address them right away. So changing an individual's perception of bullying and uncivil behavior from acceptable or we just have to tolerate that person's behavior. We need to shift to that it's not going to be tolerated, and that it is unprofessional, and that we don't accept that behavior any longer, and that individual, hopefully just one, will have to make their own change or move to an environment that will tolerate that behavior, because we are going to make change. We are going to bring ourselves to a new higher level of professionalism. So we're going to reflect not only on civil practice, but the cultural competence that is necessary in order to, and I like to say cultural awareness or cultural sensitivity, to understand that we're not the same. We're all different, but we have a common goal. And again, as I shared earlier, we care and we want what's best for the health and welfare of our patient population. And I might suggest that we have that same caring for one another. And for others in other settings that we might function within, home and our community. So really giving nurses the tools to respond professionally and not react with emotion when those situations arise is exceptionally helpful in many of these situations. So we want to give ourselves the tools to respond and really consider the well-being of one another and help to de-escalate those emotionally charged situations when and if they arrive. So as nurse leaders and healthcare leaders, we have an obligation to really impact and in terms of modeling the best practice, really creating those healthy work environments and settings in which we have many elements that have to kind of fall into place. And this really takes time. And I'll address that a bit more later, but it takes time to have a culture shift. And some of the elements that can be very helpful are policy. So implementing policy to increase awareness around the most professional practice behaviors. And really looking back, gosh, 2008, the Joint Commission did not mandate, but they suggested that hospitals create zero tolerance policies regarding disruptive or bullying behaviors. So 2008, does your workplace have a policy? Is there anything that can support an individual in speaking out against uncivil behaviors or bullying in the workplace? We really need to consider these interventions to support our peers, support ourselves, and really to raise the level of awareness and increase the safe patient practice. Okay. So I've addressed a lot of things today, and some things I've addressed well, others, well, you can make your own assessments there. But civility requires these antecedents. A civil environment is one that values and respects communication and respectful communication, in fact. A sender and recipient of information may have differing opinions or points of view, but that conflict can be managed in a very respectful way. There needs to be a willingness to engage in active listening and to participate in a respectful way when there's conflict or discourse, right? To exchange sensitive information in a professional manner. And as I mentioned briefly, this takes time. You do not just develop these skills overnight. We do not break bad habits overnight. So really arriving at the capacity to respectfully negotiate, it's going to take a lot of practice, really. And maybe asking your colleagues to work with you to build that professional environment, an environment that is safe for individuals to speak their mind in a respectful manner, but really just to drive the setting and really develop the most authentic work experience, right? It may not be perfect, but just an environment in which you feel safe to communicate and that you feel supported and that you feel that you can speak out to do the same. It's a game changer. It really is. So again, it takes time to develop new skills and to strengthen our workplace and classroom culture. If you're working in an academic setting, it really does take time, and setting that groundwork is a critical part of it. So what are the questions that we're going to ask ourselves, right? How do we respond with new heightened awareness around civility, bullying, and the impact on our work environments? Is bullying easier to address than uncivil behaviors? That's a question to be asked. How can we address early the uncivil behaviors before they become repetitive, before they become the norm? What can we do? So I pose those questions to you for a time of reflection and encourage you to really think about those elements. And finally, I do want to share with you PM Forney. I shared his quote to begin with, and I want to share these the 25 rules of considerate conduct. That is from his 2002 bestseller, Choosing Civility. And again, there's so many great ideas here. I won't read those to you, but listen, be inclusive, be kind, really accept and give praise regularly, right? And think about respect to one another's time, not asking for favors, apologizing earnestly, and avoiding personal questions in the workplace. Just avoid it. It's not necessary. It might put someone on the defensive. And don't shift responsibility and blame if you are partner to a problem within the workplace or any small or large issue. Just accept, address, and move forward. That's professional behavior. Again, I want to thank you so much for your time, for your listening, and I hope that I've triggered some thoughts and ideas of how you can make change in your workplace. And I'll close with this. There's no shame in realizing that you've been behaving in an uncivil or bullying way. The shame is realizing that you are or have and do nothing about it. So if you've been openly criticizing coworkers, or if you have been criticized or made fun of mistakes of others, make a vow that you won't allow those behaviors in yourself or from others to take place again, that you're going to speak out, be kind, respectful, and really drive our entire healthcare system to a higher level of professionalism. Thank you.